If you've had a bad sinus infection, you know how rough it can be. Now imagine that infection hanging around for months.
Oh, wow. They call that chronic sinusitis, but a new treatment may offer some relief. The Fox Medical team's Beth Galvin explains.
You probably heard about heart stents that are used to help open up blocked arteries. Well, this device is very similar to those. It helps open up sinus blockages, dissolving over time as it releases medication right to the source of the problem. For Jessica White, just getting through the day was getting harder.
Lack of energy, felt horrible, felt pressure, congestion, everything.
By this spring, the 28-year-old medical billing specialist felt like she was having a migraine every day. But the problem wasn't headaches, it was sinusitis, a chronic nagging sinus infection that Jessica just couldn't seem to shake.
The symptoms of sinusitis would include head pressure, facial pressure, blocked breathing, sometimes vision alterations or blurriness.
Ear, nose, and throat specialist Dr. Aaron Rogers says sinusitis is sometimes triggered by nasal allergies. But for Jessica, the problem was a cyst.
I never really realized I had such an issue breathing until after the surgery. Like, it just kind of opened up everything for me.
Dr. Rogers used this tiny scaffold-like implant called the PROPEL to open up Jessica's blocked sinus tissues. It holds the tissues open, kind of like a cardiac stent props open a blocked artery. And over about 4 to 6 weeks, the device dissolves, gradually releasing an anti-inflammatory medication into the sinus tissue.
It just slowly released the steroids into the tissue, so I didn't have to take anything orally and have to remember a pill or anything like that.
And after her surgery, Jessica says the infection that nagged her for so long is history. She can breathe again.
I can breathe better, my vision's better, I'm not having really bad migraines anymore or headaches anymore. I feel like me again. I'm full of energy.
A lot of us have experienced a sinus infection. Chronic sinusitis occurs when the problem lasts for 3 months or longer. And if you're having these kind of sinus problems, talk to your doctor about your options and your symptoms. The problem is usually treated with medication, and then if that doesn't work, sometimes surgery.
All right, Beth, thanks very much. Turning now to the weather, much nicer today, huh?
Yes, indeed. Ken Cook in the Fox